Ghana has become the first country to approve a vaccine for malaria, which researchers say is a world changer. The vaccine was first developed by the University of Oxford. And well, for more on this, let's cross live to London to speak with Arise correspondent Lape Olarinoye. Welcome to the show. Let's go straight into this. Very good news we're hearing coming out of Ghana. Can you tell us more about this vaccine and why it's being seen as a world changer?
Well, like you rightly pointed out there, it's absolutely groundbreaking. And groundbreaking because just late last year, there were several promises of a malaria vaccine being released by the WHO and funded by them, of course. And that vaccine had said to have been worked over a number of years, decades, if you like. And now this time around, of course, an Indian manufacturer, namely Serum Manufacturers, a biotechnology company, has managed to basically give many people across the world this silver bullet. Now, just a little bit about malaria. Now, it kills over 600,000 people a year, many of which are children, and the epicenter of the deaths being in Africa. So you can imagine how needed this vaccination is. Now, so far, the WHO has not approved the trials just because there aren't enough people for them to approve this. So far, this Indian biotechnology company that I mentioned earlier have actually managed to do a trial on a number of children, 5,000 across Burkina Faso. And the efficacy of this is quite strong. It's stronger than all the previous trials that we've had before. It's 80% with 2 vaccines and potentially a booster. And so, of course, for that reason, Ghana has become the first country, their Food and Drug Agency, to basically roll this out. There's no talk of when it will be rolled out yet, but certainly a step in the right direction.
We definitely can't wait to hear when it will be rolled out, Lape. But do we know how this vaccine is being funded?
Excellent question. Predominantly because there's been a lot of questions around the funding. Now, the WHO haven't yet approved this vaccine, and that's because there's, like you rightly asked, there's an issue of funding. So far, GSK just last year agreed to launch a vaccine, a malaria vaccine. But again, the WHO didn't have enough. Well, they say they didn't have enough funds for it to launch, as well as trial figures as well. And the numbers were within the 10 million to 15 million is how much they could fund. This time around, there's a dramatic change in things. It seems as though African governments and agencies are taking their own stance, predominantly because of what happened during COVID and the way in which Africa was at the back of the queue during the rollout. So they are very much taking a much quicker stance in this regard. Now, Serum, this biotechnology company that's manufacturing these vaccines, has promised that they are able to manufacture up to 200 million. That's the population of Nigeria. And if you spread that across Africa, especially with children, that is going to make a huge difference. So yes, the WHO haven't clarified where the funding is coming from, but there is definitely appetite that it can be rolled out across Africa.
I mean, Oxford scientist Adrian Hill did say that this Ghana's drug regulator approved it for the age group at the highest risk of death from malaria, children between 5 months to 36 months. So are we seeing a potential rollout across Africa?
Well, it's certainly in the pipeline. Burkina Faso, Mali, and Kenya are also trialing currently to roll this out. But it still stands as Ghana being that first country to take on this rollout. Other agencies across Africa have also been informed. Their scientists are also looking into it. So there's definitely a sense that it will be rolled out. And of course, because I said, the Serum biotechnology company have giving African drug agencies the assurance that they can manufacture for that demand. It's said to cost about $1 per vaccine, which in the grand scheme of things may be unaffordable for some Africans, but the fact is it will be available eventually to children who, like you rightly pointed out, are the most affected.
Lape, I'm definitely curious because I know last year we heard about the new species of, mosquitoes that are thriving in urban areas that emerged last year. So I'm just wondering if you know, of course, I know you're not a scientist, how much this has been factored in to this vaccine, in the production of this vaccine.
A great question. And I think based on the reports that we're getting from several different news agencies, there is that element of the mutation of the vaccines and the consistency of it actually is all very much included in this vaccine. There are elements of as you know, vaccines cannot be a silver bullet to every single disease in the world or infection, if you like. And so for that reason, they would have to be developed over the years. But malaria has mutated over the years, and there is a sense that across Africa that the malaria that is spreading there is hard to combat. And this vaccine promises to do so. And that's why the WHO are quite keen to extend that trial figure to more than 5,000. It's been trialed in Burkina Faso. There are evidences of it being done in the same countries as Mali, Kenya, and Malawi as well. And so for that reason, it is promising that this vaccine could be a huge help to many people. In fact, just to add on there, the mortality rate as a result of this vaccine being trialed has improved significantly as well. So that is, of course, being taken into consideration when looking into how effective this vaccine would be.
It's looking like all the factors are pointing to the fact that it is indeed a world changer. Thank you so much for being on here, Lape, a rice correspondent from London.